Ben Hull will be excused. And we do need to make a motion to withdraw item 3A from the agenda. If I could get a motion in a second. Mr. Sheridan, Mr. Fay. Any discussion? All in favor? Opposed? Motion carried. Okay, now I need a motion to approve the agenda as amended. Mr. Forsyth, Mr. Sheridan. Any discussion? All in favor? Opposed? Motion carried. Okay, so first up, we have Community Services, Jay Ulrich. Oh, sorry. Need a motion to approve the minutes. Mr. Sheridan, Mr. Lightfoot, any discussion? All in favor? Opposed? Motion carried. Now we can go on to the resolutions. Mr. Ulrich. First resolution modifying the 2024 budget for community services for COSAP 1 funding from the Office of Justice Programs. Can I get a motion, please? Ms. Curran and Mr. Forsyth. Go ahead, Jay.
All right, so this was the first COSAP grant that we received back in 2020. We did receive a one-year extension, so it's going to end the end of September of this year. So this is really rolling over the remaining amount into the 2024 budget, so we have spending authority. And all this, the $17,802 will be going to one of the sub-awardees, that would be Grace House, for their role in the grant project.
Any discussion? Seeing none, all in favor? Opposed? Motion carried. Next up, we have a resolution modifying the 2024 budget for community services for COSAP 2 funding from the Office of Justice Programs. Get a motion, Mr. Forsyth and Ms. Curran. All right, Jay.
Yep. Again, this is a rollover resolution, so we have spending authority to draw down COSAP 2 funds. You know, the budget pretty much is the same as it originally was. We do not have, the 123,533, that is for the fiscal officer that's overseeing the grant. The $7,000 in travel was a mandated conference that we are required to go to down in Washington, D.C. And then the bulk of the funding, the $953, will be split between Seaway Valley as a sub-awardee and the OTP clinic for operations.
Any discussion? Mr. Smithers.
Jay, when does this money have to be used by? What's the
It's a
extent of
three-year
it?
grant. It started in 22, so it would be 25, September of 25.
Anyone else? Mr. Forsyth.
Thank you, Mr. Chair. Jay, the 953,067, how much for us and how much for Seaway?
You know, I asked that,
Okay.
and then it just slipped my mind to follow up and get that. I can
Okay,
get
no
that to you,
problem.
though.
I
But
just
the
curious.
majority of it's for the OTP.
Substantially more?
Yeah,
For us? Okay.
yeah. So we're paying Seaway Valley for 2 peer positions embedded in our clinic.
Okay, thank you.
Any other discussion? Seeing none, all in favor? All in favor? Opposed? Motion passes. Next up is clinic services update.
Okay. So things went up a little bit in April compared to last month. The counselor average visits went down a little bit for this month. It was 71 this month, 72% last month. But the 6-month average remained the same. The face-to-face numbers pretty much identical. We do have 7 people still waiting to see a prescriber for the OTP clinic. They are connected to both peer and counselors. We'd like to see, it's not required, but we like to see those people the first time by a prescriber in person. Because then we can do the blood draw, we can do the EKG, we can do the physical. You know, they do allow you to do a physical over the phone, but it's, you know, it's just not, it's not best practice. So that's the reason for the 7 on the wait list. provider visits, they were about the same in terms of the number of individuals served. The OTP census is down. It was 173 last month. We're down to 169. We are down on our Suboxone, the medication breakdown. We're lowering that number. I mean, we can do 5 methadone dispenses by the time it takes to do 1 Suboxone dispense. So, we really want to have the OTP focus more on the methadone dispensing, plus the fact that we're down 1 nurse, so we only have 1 nurse in there right now. So, we're working in that direction. We're down to 90 Suboxone individuals. So the billing, the reimbursement rate went back up in January. The claims that were paid on page 3, I projected out if we continue, I mean, they were pretty good numbers. They're all up from last month. The December numbers, they're all up from that. I projected it out. If we continue on that, our revenue will be around 200,000 over what we projected for '24. So. And in terms of the gross charges and gross receipts, these numbers are up again from December. The OTP, it's the highest in the last 6 months, but mental health and addiction services are both up from last month. So you'll see the rebills have not gone down very much. We are down 1 medical billing clerk, and that person is really trying to stay ahead of just getting, the monthly invoices out. So we're not working as much as I would like to get some of those rebills written off if we know we're not going to pay them, so we could kind of get a better view of the trend for that. I don't know if there's any
Any
questions.
discussion? Mr. Forsythe?
Thank you, Mr. Chair. Jay, with the methadone, the Suboxone, and like in the jail, when we distribute, we rely on pharmacies to get all these drugs. Is there a way we can do it like we do our health insurance and find a company that'll give us discounts on? Is there any sort of options available? Is it just pay as you go, or?
We do have a contract, and I forget the name of it, but we had a resolution passed to sign that contract soon after we started the opioids program, OTP. And they are also not only a pharmaceutical company, they're a manufacturer, so we get good rates. I
Okay.
can't speak, to the jail in terms of where they're getting their Suboxone. The methadone they get from us.
Okay,
The
right.
methadone is like 3 cents a dose. I mean, it's very inexpensive.
3 cents a dope?
Yeah.
Okay. Okay. Thank you.
Mr. Smithers?
Jay, did I hear you say that we're short an employee for billing? You said down?
We're down 1, in the billing department, we're down 1 medical billing clerk,
Okay,
yes.
How long have we been short for there?
That's been a couple months.
A couple months?
The test is being released soon in July, so it's difficult to hire someone when the test is going to be put out for the individuals. We did put it on the website today with the caveat that they have to sign up for the test by June 5th.
Okay.
How many employees are down now, Jay?
We're down about 10 staff.
10 staff. That's a lot. Mr. Reagan?
Thank you, Mr. Chair. You said the jail buys their Suboxone from someone else, and you buy it from someone else?
Correct.
Could you, at some point, talk to the sheriff's department, see whether or not there's any economies of scale of buying together to see if there's any advantage to that? And if there's not, then don't do it. But, if there is, there might be.
Yep.
Thank you.
Anyone else? Mr. Burke?
The information you provided looks great, Jay. I guess I'm wondering anecdotally, how are we doing as far as the efficacy of treatment? I mean, what measures do you look at to know that the services you provide are producing the results that we want?
A while back, we did a satisfaction survey. I don't have those results with me, but we did that for at least the mental health side. So,
On the substance abuse, do you keep any information, any data on people who relapse? Is that any kind of statistic that you keep, or is it too cumbersome to collect?
well, I mean, we assume when they drop out of treatment that many return to use. We don't always know that, but it is just an assumption if they stop coming to treatment, then they return to use. So we have those numbers. I don't know if we know exactly how many of those went to another agency for services and/or, just stopped coming for whatever reason and returned to use. We don't know.
People that start the methadone, do you have trouble retaining them as clients? I think originally the thought was that once they're on methadone and the cravings are controlled, that they could hopefully return to some type of normal life.
Yeah. I mean, those who work the program, meaning they engage not only in the dosing and the medication, but also see the counselor, go to groups. We have a fairly high success rate of people, getting their life back, getting their kids back, getting their jobs back. I don't know if we actually track those numbers of those successes, but a lot of times, and there again, it's the same reason. Some of them do drop out because they return to use, but some of them, it could be they're at North Country Freedom Homes and they're going back to wherever they came from after they graduate from that program. So, we lose some methadone. We do transfers for those individuals if they're moving back to a different county.
Thank you.
Ms. Kern?
So even if we keep some of this information just as like qualitative sort of research questions, we should try to get some kind of records if, like, do we have people who overdose? Is everybody staying within a program? If they leave our program, should we maybe contact them to see if they are in a program somewhere so that we know where they are? I think there's a lot of agencies that feel like if you're leaving our agency, maybe we should have some contact with you just to know where you are and are you okay? I think that might help with some of these numbers. And not that a satisfaction survey is not great, but usually the only people who fill out a satisfaction survey are the people who want to complain or the people who are really happy that they're getting the meds written the way that they are asking for them to be written. So it doesn't give us the same kind of information as did we have 20% of our program move on to someplace else? Or did we have 5 overdoses last year or 2 suicides? Or those are the things that are more, how did we do?
I know in terms of overdoses, we do work with the OD MAP system. And out of all the overdoses that have occurred thus far, 2% are from county clinic. 2% of, I don't have the exact number of how many I don't have the breakdown in front of me, but 2% of the overdoses in the county were clinic clients. And then the 98% were not involved in county clinics.
Go ahead.
And just because we have Carly here, you kind of run the OD map, do you know what numbers we've had in the last quarter, half year? Okay. Send that to you. That would be something to know, like monthly or quarterly. Are there any? You know what I mean? That would be good. Thank you.
Mr. Reagan.
Jay, I think it would be helpful if we did get a handle on, you know, if we've got 100 people in the methadone program, what percentage of them are succeeding in the program and what percentage are not, so that when people ask us, you know, what's the point of the methadone program, that we can say, hey, 80% of them, 70% of them, you know, we've had a opioid epidemic in this county. We've had a huge number of people overdosing. You know, our sheriffs, our emergency services agencies are overwhelmed with the number of overdoses that they're being called out to. If we can have some information in which we can say, hey, you know, only 2% of the overdose deaths that do occur are not, you know, that they're not in our program and, you know, need to be in our program, but, you know, we can't force them at gunpoint. At least, Sheriff, I don't think we can force it, but if we can, that'll be good. But my point is that it would be good for this board to get a idea of our success with this program and let the public know that, you know, there are things that are happening that are positive that your agency is doing. And obviously, you know, we're a long way from, you know, we've got a lot of problems, but the original concept when we did the methadone program was to provide another tool to the medical community and to try to help some people that we could and prevent, you know, needless overdoses and deaths. So, you know, I would urge, you know, I'm just one member, but I would urge you to find a way to figure out, you know, what's happening and, you know, what percentage are benefiting from this program so that, you know, we can let people know and have a better understanding of what's occurring out there.
All right, I can take that back to the team.
And like I said, you know, if we can do it at gunpoint, you know, that I'd be in favor of that too, so, thank you.
Great suggestions. Be nice if we
The
had
gunpoint part?
10 staff up there that would actually help, because I know they're struggling, but. Ms. Haggard.
Thank you, Mr. Chair. Jay, I think that would be great if we had that information, but I'm thinking about people leaving the program to go back to using and how difficult it may be to get in touch with them to find, I mean, I can imagine trying to call somebody who's using. You're just not going to get through to them very easily.
I mean, if they return to use at the same rate that most of them started out at when they came to us, their life gets pretty chaotic fairly quickly.
Right. Thank you.
Anyone else? Thank you, Jay.
All right, thank you.
Next up, Social Services. Joe Siebert, Quarterly Update, Children's Services. Go ahead, sir.
Thank you. Good evening. Let me get my- All right. So tonight, our topic is our services unit. mostly children's services, although I will speak about our adult unit briefly. But might as well get started and go through this. I'll try to be as brief as I can while still answering any questions you may have. Starting on page 1, in April, we had 158 referrals, which was down from March, but still up from some previous months. They go up and down like that a little bit. Those 158 referrals involved 326 children. So that's how many kids we were, additional investigations that we had opening up in the month of April. Excuse me. And as you can see at the bottom, in terms of the safety checks, that's something we've been looking at, and I've been very, very pleased with the work that they've been doing. We're still maintaining either at 100% or 99% every single month now. They missed 2 in the month of March. These reports lag by a month. We get those from the state, so I don't have April statistics yet. And the reason for those missed ones can be, in this case, I believe that there were cases that were transferred in from another county. If another county opens a case and they don't get their check done in on time and it transfers over to us, then it shows on our statistics. So I think that's what happened this month with those 2. Moving on to page 2. Our average CPS caseload is up to 16, which is above the 15 guideline that we're looking for. And as I mentioned not too long ago, we were dealing with I don't like to use the word crisis in staffing, but that's kind of where we're at. Right now, out of the 30 positions that we have in CPS, I have 11 vacancies. But I also have 9 staff members that can't take reports because they haven't been trained yet. So that puts me down 20 out of 30. So it's an interesting situation right now. I've moved some staff over from the foster care side to assist. I have another couple staff members that are staying on foster care side, but they're helping out with contacts and notes to try and keep us going until we can get these people through their training. I did request on-site training from OCFS and was denied. However, they did add 2 more virtual sessions, one in May, one in June. So we're getting people into those to try and get our staff trained as quickly as possible and get them going. As you'll see in a little bit, that we do have a number of staff in the training pool right now that will be finishing up their training. So there is some relief on the way, but right now it's been very difficult. And that's why you're seeing the caseload come up the way it has. I have a very small number of people to deal with the number of reports that we have coming in, unfortunately. Excuse me. Moving down to the foster care at the bottom, we right now have 218 children in care. Of those, we have in St. Lawrence County foster care 30 that are in foster homes and another 83 that are in kinship homes that we've certified. So, you know, we're running a little more than 50% of the ones that we have in foster care. We're doing the 105 that are listed in other foster care. That's a breakout between the Children's Home, Berkshire Farms, and Good Shepherd. So different agencies that we do contract with to help us out with the foster care. Foster care is an issue right now in that we're having a very difficult time finding new people who want to be foster parents. It becomes problematic when we have a child that comes into care that has complex needs to find a foster home for them that is either capable or willing to take them. So we're managing, but it's difficult. And I say that having spoken to my colleagues across the state, we're all feeling it right now. It's a statewide epidemic of, well, not epidemic, a statewide phenomenon of a shortage of willing foster parents. So moving on to page 3. On the top right, the average number of children in care, I do like this. Our average for the year so far is 214. And over the last 2 years, that I've been here, we've been able to bring it down from 278 as our average to 214. I want to keep that trend going. That means we're either getting these kids onto adoptions or reunited with their families, or are able to get services in place for kids and not take them into care in the first place if we're able to do so. And that is our goal. The average days children have been in care at 812 for all the kids, 640 for the kids that, excluding those without an adoptive resource. It's coming down from last year. And again, that number stays high because we get the easy cases adopted, and that leaves us with the kids that are in care for a long time. And that kind of skews that number upward a little bit. And of course, with everything else, our average foster care preventive caseload is up to 10. OCFS recommends on that side of the house between 10 and 12. So we're there. The cases that we are getting in seem to be becoming more complex. We're getting more and more cases with larger numbers of kids, whether it's 3, 4, and 5 at a time sometimes. And that's why our number is up to 218 this month. We were getting very close to getting under 200, but then we had one case with 5 kids, another case with 6 kids, and that seems to be the trend that we're seeing right now. Moving on to page 4. We have 151 kids in home receiving services. That's down from last year. I want to do what we can to bring that number back upwards, so I'm hoping we'll see that trend change. I want more kids receiving services. If my personal philosophy is if we can keep kids in the home receiving services and try and repair the home unit rather than have to remove a child, that's less trauma for the kid, less trauma for the family. Obviously, cases of severe abuse, we can't go that route, but there are a lot of families out there that just need a little bit of support. So I'm hoping that we can increase that number a little bit. The adoption activity, we're going really fast for a while, and now we had 2 in April, 3 in March. I met with the adoption unit, and we are going to be staffing every single kid now that has been freed for adoption on the list to find out where we are with that child, what are the roadblocks to getting that adoption finished up, is it paperwork, is it an appeal, trying to find out what's going on to get these adoptions finalized so we can get these kids out of care and onto a stable home for them. Our foster care placements, right now we're at 19 in institutional care. That's up a little bit from where we were last year, but our average has been 21 this year, so we're down a little bit. We had a couple kids come out. We're keeping an eye on that. I like to keep that as low as possible because those are the cases that are the most costly for the county. On to page 5. I'd like to talk for a second about the homeless placements and the adult protective cases that we have. In April, we had 37 placements in hotels. That's numbers, with the end of Code Blue, I don't expect that number to go up. I expect it to remain stable for a little bit. But I want to talk a little bit about some of the work my homeless unit has been doing. And I'm going to spend more time with this when we talk about eligibility. But in the 6-month period from October 1st to March 31st, we served, we brought 96 singles and 53 families totaling 287 people into permanent housing. 150 singles and 3 families totaling 161 people went into permanent supportive housing. So they've really been doing a great job of getting these people out of that cycle of staying at hotels into permanent housing. They've done a tremendous job. And today, anecdotally, we had a client come in that was homeless, found out that this individual had been listed as missing for 14 years. We're working to get that person into a detox and then back to her family in Alabama. So I'm very pleased with the work my staff have been doing today. They did just a yeoman's job working with this individual today. I think that what we're seeing in getting some of these people to permanent housing, if we can continue that trend and keep these numbers staying low for the hotel placements, I think that's best for everybody, from the clients to the county to the taxpayer. So I did want to spend a little bit of time, bragging about that, because I think my staff, they've done some tremendous work. We have 142 total adult protective cases right now. We're seeing the number start to spike up, and the cases are becoming more complex. We're seeing more need for guardianships. I'm not sure why that trend is happening. We are seeing that in other counties as well. That's something for us to keep an eye on. And down at the bottom, the caseworker training period, the training pool we had for foster care preventative, their training is complete. We only have 2 vacancies on that side of the house, so we're actually doing well on the foster care preventive side. We had a number of staff leave in a short time on the CPS side for a number of reasons. Some of them were promoted to other positions. We had one individual move back to North Carolina to stay with family and go back to school. We've had people leave, we discussed before, for better pay and less stress. So, this job is not for everyone. But right now, in the training pool, we've got 5 who are still working on the training that are in the pool, 1 who has completed training that's still in the pool that we need to get moved out, and 1 slot in the training period that is vacant. I'd mentioned our staffing issues earlier. It is something that we are concerned about, and I am meeting weekly with our staff. By the way, today is the first official day of my new Director of Services, Ms. Kim Terrell. We promoted her to that role. She did an outstanding job when we moved her up to a grade A. And she is taking a very objective look at all of our children's services, and she and I are working on maybe retooling the way that we think about doing business in terms of possibly moving towards a pod type of a situation where the same group of people, same group of caseworkers will work with a child from investigation all the way through adoption if possible. So I'm excited for what she brings to the table and some of the work that we're hoping to do in the future to enhance the services that we're providing right now in children's services. And the last page is our child support petitions. You know, we had 39 enforcement petitions. Nothing really changes in the support unit. They just keep doing their job, and they do a good job of it. So,
Any questions? Ms. Haggard?
Thank you for your update. I have a question that's not directly related to the update. Thank you for that information. Have you had any opportunity or any need to deal with the STAR company or program that the adoption people?
Adoption Star, the one that we
Yeah,
discussed.
Adoption Star, thank you.
We got that approved. The contract was, I'm not sure if it's been signed yet or not. I believe it has. I haven't checked to see if we've used them or not
Okay.
since then.
I was just curious
Yeah.
if you'd had any.
We had one case that we were looking to use them for, and I need to double check and see if that's actually happened yet or not.
Thank you.
Mr. Smithers?
Yeah, Commissioner, I couldn't quite catch the name of our new employee, and so if you could just give us that again. And also, my question is, we've been talking about arming our probation workers when they go into a dangerous situation. So what comes to mind is, what protection do we provide when your employees are sent into potentially dangerous situations? Do we provide them with a sheriff to give them protection? Do we have a policy on this that you go by? And then how would you define the dangerous situations that sometimes they're sent into?
I'll start with your first question. Our new Director of Services is Kim Terrell. She was a longtime employee. She's been with us, I think, 20 years on the foster care prevent side, promoted to a grade B supervisor, then a grade A, and is now our Director of Services. So she's well versed there. In terms of, I don't have a written policy on that. It's probably something we probably ought to take a look at, but because every situation is so different in children's services, we're not going to houses knowing that somebody, has a warrant or has been a felon. That's not something that my staff generally know about. What we do sometimes know is there's guns in the house, and sometimes we know that there's somebody who has been very vocal in their statements to staff, you better not come on my property, that type of stuff. When that happens, we do request local law enforcement to go out with our staff and the sheriff's office and our different local municipal police officers, police departments have been, for the most part, very helpful with that. It's hard being a social worker and not a law enforcement officer going into these situations. They don't train for that. They're trained for de-escalation techniques, for verbal techniques, and my staff seem to be very good at it. But they need to do their homework ahead of time before they go into a situation. If they think it's going to be dangerous, we call, and if it seems to be when they get there, well, they will disengage and then contact law enforcement before they go back to the house. And I have done some personal defense classes for my staff as well. I did have one caseworker who was assaulted about 3 weeks ago.
Mr. Burke?
You're still doing the exit interviews,
Yes, sir.
Joe? And are the results they're published on our website. Any trends that you've noticed?
The trends that I've seen were a lot of people left to go to a couple different agencies that were offering remote work and higher salaries. That was the biggest trend.
Thank you.
Mr. Fay.
It's, I think part of the issue is I've got so many newer staff members that they don't feel ready to step up and request that level of responsibility. Some of the older staff members are very comfortable where they are. You know, I'm right now considering my vacant grade A position now that I promoted Ms. Terrell up to the Director of Services. And I'm not getting a lot of volunteers. So I think it's a combination of a lot of new people, and then some of the older people are, you know, in terms of the level of responsibility, you know, people don't want to, you get into that spot, you know, you're going to be getting phone calls all night, pretty much every day. And a lot of people don't want that intrusion into their lives. It's not for everyone.
Mr. Forsyth.
Thank you, Mr. Chair. The personal defense training classes, how well attended?
I've done a couple of them. I limited it to, I believe I had 12 in each class that I've done so far, and both of the ones that I did were full.
Good, okay, that's good.
Anyone else? Seeing none? Thank you, Joe.
Yes, sir.
Appreciate it. Next up, we have Youth Bureau, Alexa Chase. Resolution modifying the 2024 budget for the Youth Bureau for youth advocacy and training programs. Can I get a motion? Ms. Terminelli and Ms. Curran. Go ahead, Alexa.
Good evening. This budget modification will allow for spending for youth advocacy and programs. The funding that we receive from OCFS is divided between youth advocacy programs, our youth sports and education, as well as our youth development programs. So by approving this budget modification, this will allow for advocacy spending such as our paying for our youth summer programs, as well as the advocacy efforts that we have with area schools, such as our Gizmo programs.
Any discussion? Seeing none, all in favor? Opposed? Motion carried.
Thank you.
Alexa. Okay, we're up for the Vacancy Review Committee. Ms. Doyle.
Good evening. The Vacancy Review Committee met on May 7th and reviewed 15 positions. This evening you have, I believe, on this agenda, 3 departments who will be presenting to you. Currently, we have at the beginning of May a vacancy rate of 9%. We are seeing 92.9% immediately filled, 1.7% held for 30 days, 2.6% held for 60 days, and 0.8% held for 90 days. The trend we're seeing currently, if we were to stay at the average number of positions on a monthly basis, would be around 150. And if you recall, the average that we typically are working with on roughly a 3-year assessment is about 162 to 165. So we're just coming in a little bit below that, but as you know, 1 month can change that dramatically. Also, what I'd like to keep you versed in is the part-time, the temporary, and the probationary fills, which the board has been gracious and given me permission to move those through without additional action. And there have been so far this year, 29 of those. 26 of those, this is the remarkable fact on this report, 26 of those have been during the probationary period. So that would mean that folks who have signed on, come to work, have either not worked out, chosen to depart, or for another reason not made their probationary period. So that's an alarming number to me. And I think going to that exit interview component, sometimes we hear from folks and they schedule their separation with us, and sometimes they don't. So working on that, but I thought that was a valuable interest to you as we look at the continuing trend of being able to find workers coming into all of our departments. So that being said, unless there's any questions, we'll move forward to the vacancies. The first is community services. Jay?
asking to fill a chemical dependency counselor position for our addictions clinics. This position has been in the budget. We left it in the budget. We just didn't ask to fill it. That was vacated back in May of last year due to a promotion. One of the reasons why we're asking to fill it is we have a 17-year employee who is slated to retire in the early fall. There are some medical complications that may, make that happen sooner. So we're hoping to just kind of be prepared for that and have the permission to fill it if in fact that happens. Of course, as everyone knows, staffing is difficult right now. So, it might be a month, 2-3 months long process, so it is to try to fill this. So we are asking for an immediate fill. So when that person does leave that position, we have some continuity of care for that caseload.
Any questions? Mr. Reagan?
Jay, with the, I was looking at the job qualifications, and under B, it said credentialed alcoholism and substance abuse counselor certification, or credentialed alcoholism and substance abuse counselor trainee, so recognized and documented by the New York State Division of Alcoholism and Alcohol Abuse. How does someone get that?
There's coursework that you have to go through, typically through a college, to get that programming. Sometimes Oasis may deliver that content as well. They've actually raised it to wanting them to have a bachelor's degree. So they did grandfather the people in with a high school diploma, but moving forward, they want you to have a bachelor's, so they kind of upgraded that position.
So in order to get the position, you have to have what?
I don't know the number of hours of coursework that it takes. I can find that out.
Could you find that out and put that in there so that we know? Are we talking about an associate's degree? Are we talking about a bachelor's degree? What is it we're saying so that people who might be interested in coming to work for the county can know?
Okay, we can do that.
Thank you.
Yep.
Anyone else? Okay, thank you.
All right, thank you.
Next up, we have public health. Carly is here.
Good evening. So this first vacancy is for a service coordinator position. We had the good fortune of being able to promote one of our service coordinators to the senior service coordinator position. So now we're just looking to backfill one of our 4 service coordinator positions for the children's programs.
Any questions? Okay,
Next one is a create and fill.
Yep, so this one is for a communications specialist position. We currently have someone doing this work as part of the New York State Public Health Corps Fellows Program. Unfortunately, her contract is going to be ending the end of June, and just seeing all of her hard work and the work that she's done as far as branding. I'm not sure if any of you follow public health on social media, but she's really the one behind creating that specific branding for public health. So this position in part would be working on social media. Part of it would also be creating those press releases, as well as keeping our website up to date. As we found out, during COVID, unfortunately, the importance of having communication with the public that's clear at appropriate levels and at the appropriate frequencies, you really come to value having someone in the department that's just dedicated to communications. And this position is supported by our infrastructure grant, which will run until November of 2027.
Any questions? Mr. Forsythe?
Thank you, Mr. Chair. Carly, thank you. Do you think there's enough communications there to keep you busy?
There is.
Really?
Yeah, and part of it too is involved with like, registration for our events. And we like to have one person being the coordinator for our social media posts too, just so we have one person that knows everything, that's going out. Certainly our other staff also work on content creation, but it definitely helps to have that one
Keep
person to streamline.
specific to it.
Yeah.
Okay, thank you.
Mr. Denisha?
Thanks, Mr. Chair. Carly, this position, it looks like it would be a position that would lend itself to remote work. Is that, could this position be fulfilled remotely? I guess that's.
I think part of it could be. So the person that's fulfilling these activities right now, as part of the fellowship, they do have the flexibility to do some telework. So I could see parts of it. There's absolutely benefits of that being a hybrid position and being able to come into the office and meet with people, especially when we're talking about some of our content creation. A lot of our social media posts that get the most engagement include photos of our own staff and kind of sharing our own office too. So I could see it as hybrid.
Mr. Smithers?
Thank you. In the summary, it says that new positions created were 3 and abolished were 3. This is a new position, but it doesn't have an abolished position attached to it. And it says this is 100% reimbursed by local, state, or federal funds. What funds is it? Is it from the state or federal? And is this an ongoing thing? Is it just like for now it's funded, or do you expect this to be fully funded going on from here?
Yeah, so this comes through New York State, through the Public Health Infrastructure Grant. We know that the grant will continue through November 30th of 2027. With all grants, I'm not sure what that means going forward, but for now, we know that we have the money set aside for the salary. Yeah.
So to Legislator Smithers' question, when you look at the form itself, in the top left side, it says type. If there were in a position going away, it would say abolish and create and fill. This one is a create and fill by itself. So that's the difference. And then underneath position abolished, where it says NA, you'd have a position number there as well, if in fact this were an abolish and create. So those are your 2 places to look. And we are working to revive this form and separate off the data that's important internally from the information that's important to legislators. So work in progress, but that's how you could tell the difference.
Anyone else? Mr. Forsythe?
Thank you. So what is the salary? How much do they make?
I think that's still being looked at.
Must be a cap on the reimbursement, correct?
Still in review? Will we have it before the board meeting, you think, or? Okay, good. There again, someone's looking for a job.
What the range is. Yep, agreed.
All right, thanks.
Anyone else? Thank you.
Thank you, Carly. And the last department up under vacancy review for this committee is Social Services. Returning to their multiple presentations. As you heard in the director's or the commissioner's report tonight, there are a significant number of vacancies that we'll be discussing this evening.
Good evening again. Going in order on with the agenda, the first one I have is a caseworker from the foster care side. I'm going to preface my comments regarding this. When I walked over, I left all of my notes regarding where these people went on my desk. But I can say of the 6 vacancies that I have, 5 of them stayed within the county, either promotions in my department or a lateral transfer or to a different department. One of the individuals moved back to North Carolina to go to school and spend time with family. So of the 6, 5 are still county employees. So again, this position is in foster care. As I discussed earlier, the state recommends no more than 12 We're creeping up. We're at 10 right now, but I am trying to move some of my foster care caseworkers around to give a little bit of relief over on the CPS side. With that said, you know, I don't want us to go back to where we were before in terms of not being able to get these positions filled. The cases that we're getting in foster care, as I said earlier, are getting more complex. They have more children per case that we're getting in. So with all of that in mind, you know, it kind of trickles across all children's services right now every time I have a vacancy on either side. So I would ask your permission to move forward with this particular position.
Any questions? Seeing none? Okay, next.
The next position is a keyboard specialist in our Disabled Client Assistance Program. Now, this is a unit of 2 people, and one of position is vacant, so they're down to 50%. This individual, the keyboard, they're like the entry portal for anybody that comes to the department wanting to apply for SSI or Social Security Disability Insurance. And where that's important is that if we can get people through the application process and get them approved for their federal benefits, then they won't be on our TA rolls. And last year, we recovered for the county $117,000 in annual interim reimbursements by, you know, getting people off the TA rolls and going on to the SSI and SS. And anybody who knows anybody who's done it, it can be a frustrating process for individuals to get their disability approved. And again, this is a unit of only 2 people with the keyboard specialist out. The DCAP agent is flat out right now, so I would ask your permission to fill this position.
Any questions? Okay, thank you. Moving on.
The next one is a caseworker in CPS. Actually, the next 2 are. So if you don't mind, I'll cover both of them at the same time. I mentioned earlier that we are at 11 vacancies right now on the CPS side. I've got a number of staff members that can't take reports due to the training restrictions that we have. We are up to 16 on the average caseload, which is 1 above the guideline that I was so happy to get underneath of before, but you know, we had a lot of these vacancies seem to have happened all at once. It was kind of a perfect storm of stuff that happened over the last couple of months. So I would ask your permission to fill these 2 positions in the interest of keeping up and not falling farther behind.
Any questions? Okay, moving on to the examiners.
And my last 2 positions are social welfare examiners, both in TA SNAP. Again, these are individuals that are processing the applications that come in. Each individual is responsible for 20 applications monthly. Each examiner covers about 30 TA cases and 330 SNAP cases, serves of over 600 individuals, and that's each person. So having 2 people down, the other staff members are picking up the slack. Now that we're going into the summer, you know, we have different needs for individuals. We are going to see these come back up, particularly once we get over the summer and kids are out and the families need more things at home. So I would ask your permission to go ahead and fill these 2 positions as well.
Any questions? Okay.
Thank you all.
Okay, next up will be committee reports. Board of Health, Ms. Kern.
Hi there, sorry. So the meeting minutes that I have are still from March. April's are not out yet. One of the things I was not able to provide the last time is that they were talking about healthcare for the aging and the fact that by 2027, 29,000 people, or approximately 1/3 of the population of our county, will be over the age of 65. Currently, there are 4 nursing homes in the county, all have a waiting list. Our nursing homes struggle to keep adequate and safe staffing levels due to limited space in these nursing homes. Many residents are being placed at this time out of the county, which is being reported to be the cause of the huge emotional and financial strain on the families. And there continues to be a lack of home health care aides in our county. The mandated New York State raise in pay they feel has helped, but not come close to solving what we need in numbers for home health aides to keep people aging in place in their homes versus having to go to a nursing home or like an adult assistive home, which we no longer have in this county.
Okay, any questions? Thank you. Mr. Burke, CDP Board of Directors.
Head Start Executive Director and Head Start Leadership met with the Superintendent of Colton Pierpont. They were looking at the possibility of having a locally designed program, and the discussions are still underway, but the end-of-year activities have begun for Head Start. And the director is working on a change of scope because of the lower enrollment. They hired a new housing director, Christine Martin. The Neighborhood Center recently had a review. They met 55 of 58 standards and 188 out of 192 indicators. Weatherization program, they have had several meetings with the developers for the $1.5 million grant for Canton and Potsdam housing. And they've started to install, I'm not 100% sure of this, but I think it's 50 air conditioners for the summer cooling program. That's it.
Anyone have questions? Okay, moving on. Thank you, John. Ms. Haggard, Community Services Board.
Thank you. I can't remember the date we met, but it was the first Tuesday of the month. Anyway, there's an RFP out for the opioid settlements, and that's going to be due the first week of June. We'll probably have a special meeting to look at those proposals. It's anticipated that the 2025 money for the opioid settlement will be down quite a bit from what it's been the last 2 years. My understanding was, and Mr. Ulrich can correct me if I'm wrong, the first year was 2 years combined, and so it's going to taper off in 2025. They're working on the local services plan. We had, it was mentioned that Dr. Franks resigned, and so they're in search of a replacement for him. That's very important. Claxton Hepburns received a very large grant for the children's services. They're going to be able to add 22 beds for the psychiatric part of the children's services. And under the agency updates, the Transitional Living Services now has 14 beds at a location on Ford Street, and those are people that can stay there for 9 months. That's very good. SUNY Potsdam received a large grant. They're adding providers for online services for the college students only. They use a service called Protocol, and it's only for the college kids, but there are other users for that. The 988, the Suicide Number Coalition, will have a meeting in May sometime. I don't know what the date is for that. And that's all I have. Thank you.
Anyone have any questions? Okay, thank you. Mr. Denisha, Office for the Aging Advisory Board.
Chair, we have not had a meeting since my last report, and our next meeting is Monday, June 10th at 10 a.m.
Okay, thank you. Ms. Terminelli, Youth Advisory Board.
Hello. We have not had another meeting since my last report, but I do have a couple of updates. The first one is every 3 years, the Youth Bureau puts out the Community Needs Assessment Survey. So last year's survey, the last survey we had was in 2021, and there were 696 completed surveys. Those are for students ages, or in grades 6 through 12. So the survey is out again this year. It went live on Thursday. We've collected 269 responses so far. And they use the survey, there's questions, and then they use them to determine programming, ensuring that there's programs of interest. They look at the social emotional responses to see if the workshops that are being provided are tailored to the needs of the community, the youth in the community. The survey does close on May 31st, so every student in grades 6 through 12 should definitely be completing that. You can access the survey. Most of the school districts have pushed it out, but it's also on the Facebook page and the website. And then the next exciting announcement is the Youth Bureau has partnered with the Madrid-Waddington School District, and they're going to be offering a mental health community fair in honor of Mental Health Awareness Month for the month of May. That will be taking place on Wednesday, May 29th from 4 to 8, and it is a kind of a family event. At 4 p.m., Alexa will be offering QPR, the Question, Persuade, and Refer class for adults. And at 6 p.m., the teen ambassadors will lead a teen-to-teen discussion on reducing the stigma associated with mental illness. At 7 p.m. on May 29th, Dr. Jean Twenny will speak virtually about teens and cell phone social media use in the auditorium. This event is open for all families. It's not just for Madrid-Waddington school families, so anybody across the county is more than welcome to attend. And then our next, the youth meet virtually on Sunday at 4 o'clock, and then our next committee meeting for Youth Advisory Board is August 20th at 5:30.
Any questions? Thank you.
Yep.
How about any old business? Seeing none, how about any new business? Okay, executive session will be with the Operations Committee. We're adjourned.
Mr. Webster and Mr. Perkins. Any discussion? Okay, seeing none. All in favor? Any opposed? Can I have a motion to approve the minutes from April's meeting? Mr. Forsythe and Mr. Perkins. Okay, any discussion about them? Seeing none. All in favor? Okay, thank you. I have a resolution modifying the 2024 budget for the St. Lawrence County Clerk's Office for overtime costs at the Department of Motor Vehicles. Moved by Mr. Burke and Mr. Forsythe, and we have Sandy Sanamore here to talk about that. Welcome, Sandy.
Thank you. So my request is to move $15,000 that was placed in contingency over to my DMV overtime account. Some of what I'm going to tell you right now is going to apply later because I'm going to ask for a vacancy filled tonight as well. In 2023, $4.5 million was delivered to the county treasurer from my department. $3.5 million was from the DMV. We were at 29% of our projected revenue at the end of April this year. Last year, at the end of April, we were at 23%. The DMV has processed almost 40,000 transactions so far this year. This is over 6,600 more than last year at this time. We have total DMV receipts of over $5.5 million, which is almost 809,000 more than last year at this time. Out of the 80-some working days from January 1st till the end of April, 41 days I was short-staffed. We need about 15 employees to efficiently run the DMV, and that's with 3 at each one of the satellite offices, and we need at least 5 in the Canton office. So of the 41 days that I was short-staffed, we only had most of the time 3 or 4 staff there, which is very hard, very difficult to fill all the stations and serve the public and still do downstate dealer work. As you all know by now, probably in May of 2025, we're going to have a requirement in order to be able to fly in the United States or go into a federal building, you're going to need to have a real ID or enhanced driver's license. That is going to increase our business substantially for those people who are going to need those to be able to go on their vacations and do the things they want to do. If you've all seen the license renewal schedule, you will see that within the next couple years, I think next year, we're going to double our numbers, and we're going to triple our numbers the following year. So that's going to be a lot of people in our office, which is going to leave even less time to do downstate dealer work. Those transactions take a lot longer than you just coming in and renewing your registration or getting a standard driver's license. Excuse me. I'm also going to be short-staffed this summer. I just found out this morning. I knew I was going to have 2 people out on medical leave this summer. Now I found out I'm going to have 3. It's our busiest time of the year, and I'm going to be down 3 automatically. That's how many I allow off in a day. So for anybody who else wants a day off, I'm going to have to refuse it. For anybody else that wants to call in, it's going to be a hardship on the department. So some of these things, like I said, are going to apply to what I need for a vacancy later. But also I just need to transfer that overtime money. Pretty much for the last 3 payrolls, I've used $15,000. So this 15 is probably not going to last long either because we are going to be short-staffed.
Mr. Smithers had his hand up first.
Yeah, when you say that a real ID is going to be needed, could you explain what you mean by that? What is a real ID?
A real ID is
Yeah,
going to be, they just do a bigger background check on you. So like, same with the enhanced license, in order to, it's telling who you are, I guess, more realistically. The standard driver's license doesn't do any of that. Pretty much anybody can go in and get a standard driver's license. It's been out for a couple years that you could get this, but it's now going to be a requirement in order to be able to fly within the United States even.
Okay. Next was Mrs. Haggard.
Thank you, Madam Chair. Mrs. Sandamore, I seem to recall you were here a few months ago asking
Correct.
for a position to be filled. It was not approved.
Correct.
This $15,000 covers what time period? How many months?
The whole month, all of it, right from January until now, but
Okay.
mostly for the last couple of months, because as summer comes, we get busier and busier.
Okay. So as a result of not having that position, would you say we're getting into using more and more overtime?
Absolutely, yes.
Okay, so that's expensive, right?
Mhm.
All right. And I can't think of another department, and help me out if you can, that is as money-making as the DMV.
True.
And would you repeat the numbers for me? I didn't quite catch what your projection was or what you've made so far, the 29%?
Right, so we're at 29% of our revenue already this year, at the end of April, nothing from May yet. And last year, we were at 23. Yep. And
Okay.
just so you have more numbers, the average employee brings in, they do $2 million worth of work, but that nets about $20,000 per employee for the county that we keep in the end.
Thank you very much.
Mr. Forsythe.
Thank you, Madam Chair. Thank you, Sandy. How long does it take to get a DMV person up and running and so they can sit behind a desk and do this stuff?
A minimum of 6 months, some
Okay, so
people up
6
to a year,
So 6 months before they're even,
right?
okay, that's all I needed. Thank you.
Thank you. Mr. Reagan, you were next.
Thank you, Madam Chair. Sandy, with the Real ID, when did you say that's going to take effect, that you're going to need
May
these?
7th of '25.
And could you explain the difference in terms of what people are going to have to present to the clerk's office to obtain a Real ID versus what they currently are able to present? I think the general public does not know what it is the federal I mean, this is a federal government requirement. This isn't a state thing. This is something the feds
Yes, and
have
there's
gone to. And there, was it 7 pieces of identification, or?
It depends on the identification, each has
and could you
points.
And could you tell us
Yeah.
what they are?
It depends. May I ask my deputy to step up? Sorry, Lisa. She's much more in tune to this than I am.
Hi, I'm Lisa Woodard. I'm the deputy, but I oversee all the DMV offices. So with a standard license, that's what you would normally get when you go into the DMV. But if you want a real ID or an enhanced, a real ID will get your air travel within the US. It will give you into federal buildings. It will get you, I'm not really sure that the other one, it was federal buildings, military bases. But the enhanced will get you border crossing. So that's an additional step up. So it's standard, then a real ID, then enhanced, and the very top is the passports. So the enhanced will get you border crossing to Canada and to Mexico by land or by sea. So there's certain documents you need to have. For a real ID and enhanced, it's the same document. So you need to show proof of your citizenship. So either your birth certificate or your passport. You have to have your original Social Security card. You have to have 2 proofs of your New York State driver or your New York State residence address. And there's a whole list of documents that they will let you accept, and we have to take what's off the list. We have to scan all those documents into the computer, take a new photo, then it requires 2 people to process them. So it takes quite a bit of time to do these type of licenses in the office.
So what, I think a lot of the general public has no idea that this is coming. And what are our plans to make them aware so that, when they decide to go to the Caribbean or to go to Canada or whatever, they have the proper documentation. And, I would assume that the sooner they get this documentation from you guys, the less it's going to be a crisis in 2025.
Right, it actually started before COVID. It was supposed to happen and be before COVID, but then COVID hit and they pushed it back. And then they pushed it back again, and they pushed it back again. And I've asked, and they're like, nope, it's happening May of 2025. Nope, if, ands, or buts, it's not getting pushed back this time. It is going to happen. So at one point, I put it in North Country Now. Do you know you need to have this? Are you prepared to have this? Are you gonna have the right documents to have this? And we kind of saw like a little trickle in, but then if you go to the airport, they used to have big signs up. Are you Real ID compliant? Do you have the correct document to be able to fly? I haven't flown lately, but I asked, I'm like, did you see anything at the airports? The commissioner of motor vehicles said he was putting things out to the public, advertising this. Every time a 16-year-old comes into our office to get their permit, we ask them right then and there, you want the standard, you want the Real ID, or you want the enhanced? You have everything with you today. You have your parent present, you have your birth certificate, you have your Social Security card. You might as well get at least the Real ID. It doesn't cost anything additional for the Real ID, but it costs an extra $30 to get the enhanced on top of your permit fee. And we're pushing that with our 16-year-olds that are coming into the office, because then they don't have to come back ever again as long as they carry that onto their license. And then the parents are aware either, and they're like, oh, okay. So we're pushing that there. We haven't pushed it anywhere else.
Could you reach out to the media as well as to the airports to get, I mean,
Well, the local airports for us here,
are Messina and Ogdensburg, and, because it's going to be, that's where it's going to have the impact, and the more information we get out to the public now, the better off we'll be in the long term.
right.
Okay, next up is Ms. Terminelli.
I was just going to say, I was in the DMV, I got an enhanced license, and actually there was a little flyer right in my renewal when it came in the mail that said the different options, and so that's how I became aware of it. And when I went to the DMV in Messina, there were the sign markers in the line that tell you about getting it. So certainly as people are getting renewal forms, that information is out there. Sandy, do you guys have a way to see the different types of licenses that have been issued in St. Lawrence County to know the percentage that just have a typical license, an enhanced license, and a real ID? Just because, like you mentioned, I mean, this process has been out there for people to know that it was going to take place for a few years. Do you have a way to see that?
We don't see how many have it. We can track monthly how many we've done,
Okay,
but not to know how many people already have it.
all
I
right.
don't think we've ever had to track that.
So not a way to anticipate how many people actually need to go through that process and how many maybe have done it in the past few years?
No, we get the renewal schedule, but we don't know how many of each license.
Gotcha. Okay, thank you.
Mr. Lightfoot?
Sandy, I want to thank you for coming in with some facts and figures. It's a much easier issue to look at when you back it up with some numbers. And I'm wondering if perhaps tomorrow or the next day, that you could zip an email with some of that statistical information to us, the numbers. I got the 29%, I got the 22%. You know, I'm looking, the dollar amount I didn't get.
Okay.
But those kinds of things, yes. You say too, that you've got 3 people that will be going off on medical leave. Any idea how long they will be gone?
All 3, 6 to 8 weeks.
6 to 8 weeks? Okay, all 3?
All 3.
Okay, all right. And, okay, the $15,000. I know you got different rates of pay over there, but how many hours does it take to eat up $15,000 worth of overtime?
Not a lot. Like I said, in 3 payrolls, we did that. I don't have the hours.
So it's
but I
not a
think
lot of hours?
It's not a lot of hours.
Okay. So with not a lot of hours, have you been able to keep up?
It's been a struggle some days. I mean, I have pictures of 4 totes in front of the supervisor's desk, of a couple of days where we got behind and we would get a call or 2 from a dealer saying, where's our work? Because they're used to us being a lot faster. So, you know, we try to pull those out, get them done quickly, get them to them, being that they've called. But yeah, we've had a few days where we've had some struggles.
Okay, if I may? Have you had any outreach with the downstate people that caused this increase, if you will, in the percentages that you quoted, 22 and 22 last year, or the year before, 29 last year? Is there a corresponding increase in the number of registrations that you're getting, or what's the reason?
I just think that that now finally vehicles are available, parts are available to finish these vehicles. So I think that it's just getting to the point after COVID where that's finally catching up and people are buying new vehicles.
All right, thank you.
Next up, Mr. Denisha.
Sure. And this is back to the licenses. I renewed my license, I think 3 years ago, and I also have a passport. Are you telling me that my passport is no longer going to be valid for?
No, your passport is even better than all of the rest. Anybody who has a passport, they can have a standard driver's license and they'll be fine. But a lot of people would rather not have a passport and just have a driver's license of some sort.
Great, thank you.
Like if you wanted to go, you were out, and you're like, I wanted to go out and go to Canada to get something to eat and didn't bring your passport. You could just use your enhanced driver's license. You wouldn't have to go home to get your passport or something similar to that.
Okay, great.
Easier to carry.
Mr. Webster.
Along with that email that Mr. Lightfoot asked for, can you also give us each license and what documentation has to be present to get that license? So that we'll have an idea, because we can bring it to our town boards too and let them know.
Yep, there is an actual pamphlet at the DMV that it says exactly what a standard is required, the real ID what's required, and the enhanced. It's like a 4-page, just open it up, and it lists everything that we can accept. It has a yes and no column, what, if we can accept it, if we can't accept it, what point value it's worth.
Perfect, yeah, if you could just shoot us the email on that too, then we can get out there. Thank you.
Mr. Forsythe?
Thank you. Sandy, you did mention one thing, 29%. Did you say it was the end of April?
End of April.
So that's a third of the year, not a quarter? Okay. All right, thank you.
And Ruth has got a little update. Just wanted to give you the current totals of expended overtime. Very small amount spent, $765 spent out of the clerk's office. That's the K1 accounts if you're looking at the budget. Out of the K16, which is the downstate dealers where we capture most of this overtime, to date is $33,945. The last 2 years, last year was $52,000, in '22 it was $26,000. But after paying for all of their staff and department costs, in '21, the clerk's office contributed $2.5 million, in '22, $1.9 million, and last year again, $1.9 million. So that's after zero, they're adding back that much to the county.
Mr. Burke?
Two concerns. One, which you just touched upon, Ruth. It's a business. It's a revenue-producing business. And I guess I wonder, are we going to be able to sustain that with the shortage of staff? If we can't turn around the registrations and stuff within a reasonable period of time, I don't know what kind of feedback you're getting, but I'm concerned that we might lose some of that 1.9 million. And
Me too.
I would have to think that we would all be concerned about that. The other concern is you're going into vacation season. You said you're down 3 people with relatively long-term illness, certainly covering the vacation time for summer. That's a trend that I remember Mary Lou talking about the same thing, that there is a group of employees that even for optional surgery and procedures, schedule it in the summertime. For the rest of the people, when you're down 3, you're short-staffed. I mean, how do you maintain any kind of morale when people aren't certain they're going to get a vacation? It's a concern, and I would hope that we don't. I would hope we don't chase more people out the door because we can't afford to do that.
Anybody else? Okay, seeing none, all in favor? Aye. Any opposed? Thank you, Sandy.
Thank you.
Next up, with Rick Johnson for Information Technologies, I have a resolution authorizing the chair to sign a contract with CDW-G for Adobe Acrobat PDF editor software and modifying the 2024 budget for information technology, moved by Mr. Denisha, seconded by Mr. Fay. Go ahead, sir.
Thank you. Good evening. I appear before you in person because I've been banned for life from Zoom after that.
Temporarily.
Temporarily. Just a temporary hand slap. About a year ago, as I'm sure you remember, there was concern. It started with TikTok and bans at all government levels. Then a concern about other software, Chinese influence, which brought us to the identification of our Foxa PDF software. The recommendation you have made, which I think is a good one, to replace that software with Adobe, which honestly is the industry standard anyway. I know there are a lot of departments that are pretty happy about that, because like, oh, this works better with our stuff anyway, how about that? there is a delta between because going into, planning for 2024, I budgeted for Foxit. There is an uptick in the price, and the resolution before you is the delta between what I budgeted and what I need to budget on an ongoing basis for Adobe.
Any questions? Mr. Perkins?
Thank you, Mr. Chair. How many users does this entail? It's user license?
It is. So there are two, to answer your question, Mr. Perkins, there are two kind of levels of use of PDF software. Those of us, nearly everybody reads PDF files. And so that part is nearly universal. And then there are those who need to create and edit them. That's the number you're after, because that's the only thing we have to pay for. Everything else is free, all good. That number starts at 65, between 65 and 70. And the way that what we did was we identified all of the Foxit. I think that there are attachments to this resolution in Civic Clerk where you can see those quotes. We identified all the Foxit users, and then there were a handful of kind of carryover Adobe users. And there have been a handful of, hey, by the way, to accommodate all of those. We come in, including DSS, just under 95 total users. Yes, sir.
Anyone else? Seeing none, all in favor? Any opposed? Motion carries. Thank you, sir.
Thank you.
Next up, we have planning, Jason Fotenhauer. I have a resolution authorizing the chair to sign a third amended and restated state septic system replacement program, county participation agreement with New York State Environmental Facilities Corporation, and modifying the 2024 budget for the planning office. Moved by Mr. Forsythe, seconded by Mr. Perkins. Go right ahead, sir.
Thank you very much. Good evening. This is some good news with regard to the septic repair program. We were notified by the state that we have received additional funding in the amount of $400,000 to continue the program. We also were notified that additional eligible water bodies have been added. So that's really good news. It'll allow us to expand the program further afield in the county. At present, there are only 3 water bodies, 3 rivers that are eligible. This modification to the contract will expand it to 8 rivers and 9 lakes within the county. And we intend, once the contract has been signed, we intend to do some direct marketing to those eligible towns. We don't want to put out, a wide news release countywide, because then we'll get a lot of calls saying, hey, can I participate? And then we have to tell people that aren't eligible that they unfortunately can't. So we want to do that direct, direct mailing, or direct advertisement. May not be a direct mailing, but direct advertisement to the towns and the municipalities where the new water bodies are located.
Any questions? Mr. Lightfoot, go ahead.
You got a list of those rivers and lakes?
Yes, I do. Yeah.
Sending that out to us?
Sure, happy to do that. Yeah.
I've got a board meeting tomorrow on that. I'm very interested.
Yep. Okay, we do have it. I have a list as well as a map that shows it. So we'll send it.
Thank you. Anyone else? Mr. Forsythe.
I just want to say thank you. This is great news, and I see Lisbon's back in it again, so that's good news
Yes.
too. And maybe these resolutions do get read somewhere
I think
that
so.
we throw out there at the state, now has to expand it. So, no, I think that's phenomenal. So, great.
Anybody else? Okay, seeing none, all in favor? Any opposed? See none. Motion carries. Next up, I have a resolution accepting additional administration funding for the septic system replacement program and modifying the 2024 budget for the planning office. Moved by Lightfoot and Perkins. And Forsythe, go ahead.
Thank you. This goes hand in hand with the prior resolution. Again, even though the funding is welcomed, it would be nice to see administrative monies actually in the part of the award. The new contract does not have administrative funds, so we have been able to forge a good relationship with the Soil and Water Conservation District, and they are continuing to help us out with administrative monies. This year, they've been able to set aside $25,000 to assist with that endeavor.
Any questions? Mr. Forsythe?
Great news again. The wait list. Now, some people had applied and the funding ran out, the area changed, whatever. Should they, people that were on the wait list that are now back in the zone, should they reapply or refresh, or what should they do?
We are working with the subrecipient that has been administering the program to make sure that those people that are on the wait list are contacted. And if they are eligible, then we certainly will reach out to them. Perfect. But if someone thinks they're, once I send out the information, if you hear people that, hey, I haven't heard anything, please just have them give us a call.
Anyone else have a question? Seeing none, all in favor? Any opposed? Motion carries. Lastly, I have a resolution authorizing the chair to sign contracts with Clarkson University, SUNY Canton, and SUNY Potsdam to provide public transportation. Moved by Mr. Forsythe, seconded by Mr. Perkins and Mr. Fay. Go right ahead, sir.
Thank you. This is a contract that we have that is expiring, looking to renew with our College Connector program. This is really a huge component of the transit system. About over 50% of the ridership rides on the College Connector buses. The cost allocation is, it's a good partnership. The schools, 3 schools listed there, Clarkson, SUNY Potsdam, and SUNY Canton, pay about 50% of the cost, and the remainder, the balance of the cost, is paid by the state through through what's called STOA money, which is State Transit Operating Assistance money, and that's derived based on ridership and also miles driven. So the schools, different schools drive a little bit more. Clarkson drives less miles but has a much higher ridership number. So we're able to basically leverage the money from the STOA with the money from the schools to put out the program. And so this resolution just looks to reestablish those contracts or renew those contracts through 2028.
Mr. Reagan was first. Go ahead.
Thank you, Madam Chair. Jason, with the dramatic reduction we've seen in the number of students at SUNY Potsdam and the decreases at Clarkson and St. Lawrence, has that impacted the ridership?
It really hasn't. We've been fortunate. The ridership has really continued to go up, especially since COVID. The numbers are really really favorable. So you would think that, yeah, fewer students would equal fewer riders, but I think the numbers in the transit system don't seem to bear that out. We still have a good complement of riders, student riders.
So you're saying the numbers have gone up? Any idea how much? Since the program, it'd be interesting to see on a graph, what the numbers have increased over the years since the program first started. I've always thought this was one of the more innovative programs that's been done in the county by working together with the colleges to, make this service available to not just college students, but to citizens all across the county. And of course, the biggest problem is a lot of the general public, it still hasn't sunk in that such a program even exists. And much less that we have the program available to get people to a bus stop to get a ride. And I'm just curious, you know, what efforts we have underway to educate more people about the fact that this program's available to them.
Thank you. Good questions. I think you had the first question there about numbers. I know in the coordinated transportation plan, there's a lot of statistical data, graphs, and that sort of thing that I believe bear out that show the numbers and their rise. With regard to advertisement and getting the word out about the transit system, yes, we work very closely with the transit coordinator that is employed through the Volunteer Transportation Center. There's a meeting coming up this Thursday with the Transportation Task Force, which is a group of a number of different players, social service agencies, other representatives of ridership pools throughout the county that meets on a monthly basis to talk about just this very thing, strategizing about how to make sure that everybody does know more about the transit system. The recent introduction of the web application Passio Go has been really successful as well, where people can now, with an app on their phone, identify when their bus is going to be coming, when to what stop, and where it will be going. So is there more to be done? Absolutely, we could always do more advertising, but we feel that we really are trying to hit all the markets to get the word out about the program.
Now, at a previous meeting, I asked about whether or not you could talk to the Volunteer Transportation Center and the Office for the Aging about seeing if there was a way to help get meals delivered to the aging people that currently we're not able to serve. Has there been any progress on that?
I have met with the Office for the Aging Director. We had some discussions about that, and Volunteer Transportation Center is open to it. There would be costs associated with it, however. Their mileage, we would need to pay mileage to those drivers to do the Meals on Wheels deliveries. And so that number is I know we did some quick calculations. I don't remember them right off the top of my head, so I wouldn't want to put a number out there, but it may be possible. It's always based on staffing and availability of drivers, and that's a challenge as well with VTC, coming up with enough drivers to do the driving routes that they have. So is it possible? Certainly it's possible. Will there be a cost? There would be a county cost to it.
Now, currently, doesn't the Office for the Aging pay mileage for drivers?
Correct.
Isn't that, what's the difference in price between what you receive driving for the Volunteer Transportation Center and driving for the Office for the Aging?
I think the reimbursement rate would be the same. I think it's the federal reimbursement rate, so it's 65 cents a mile, I think, is what the,
So
67, thank you.
what would be the difference?
Well, that cost has to be borne by someone to pay those volunteer drivers.
Didn't we just say that the Office for the Aging has money available to pay drivers delivering the meals? I believe that they have enough to pay their drivers. I don't know if they have enough to pay Volunteer Transportation Center drivers as well. If they're using Volunteer Transportation Center drivers to deliver the meals on the route, wouldn't they be able to use Office for the Aging money to do that?
I believe so. My understanding from the conversation I had with Andrea that there would be additional expense associated with these additional drivers.
Meaning,
So
I'm not understanding.
I guess if we're adding more drivers, we have to pay them.
Right.
So we're paying them more money. If we have 5 drivers from Office for the Aging now, and now we have 5 drivers from VTC, we're paying 5 drivers for Office for the Aging, an additional 5 drivers from VTC. It's a 5-driver increase.
It was my understanding that we have money available to pay people who volunteer to drive to deliver meals. So does that money exist or not?
Yeah, I'm afraid I don't know
Okay,
the
so
budget.
could we
Yeah, we can, yeah.
get
we can-
this worked out? Because we've been bringing up the fact that there's a shortage of, we can't deliver on these routes for, I think it's a couple of years or more that we've had this discussion over and over and over again. I think that there's funds available to pay someone to drive to these people's homes to deliver the meals. And, you know, that, I really think this board sees it as a priority, and we need to get to the bottom of it and make it happen. And, you know, if there are problems, bring it back to this board so we can address it. Because I think the priority of everybody in this room is to get these meals delivered to people in the rural areas who need this service and who've been going without it for a long time. And, you know, so I'll check back in a while.
Thank you. Mrs. Haggard?
Thank you, Madam Chair. I have a comment and just an anecdotal observation. One of the things that's happening that may address this increase in ridership is the push to have students live on campus, so they're not living as close to supermarkets and wherever they can walk, okay? That's been a trend lately because the apartment situation, especially in Potsdam, there is a surplus now because of that. But I see these little vans all the time, and it's great because not every kid who comes to college can afford to have a car. And we all know how expensive it is to keep up a car. Plus, at Clarkson in particular, and I'm sure soon at Canton, we have a lot of people that are not from this country who come over here to study. And those people generally, I don't think, buy vehicles, probably not. So this is a wonderful program. Thank you very much.
Mr. Denisha?
Thanks, Madam Chair. Jim, thank you for your support. But something I do want to make clear that there's a great number of folks that volunteer to deliver meals for the Office for the Aging that do it gratis. And I know I'm one of them. Have been one of them. And I know there's a lot of folks. So, you know, if everyone that delivered meals was paid whatever the mileage is, that would be quite expensive. I think it's a great idea, you know, if we could have some sort of partnership with VTC, but I suspect, I know some of the folks that drive for VTC, and they actually use the money that they get from VTC as a supplement to some of their incomes. So, but you know, I think this is just we're having this conversation about not being able to afford to get meals to our elderly, our homebound people, and but yet we you know, we look at the money that we're spending on people that don't even live here, that don't belong here. talking about the driver's licenses. I know, and I'm starting to ramble, but talking about the driver's licenses, the enhanced driver's licenses, or real driver's licenses, to go to different states within the United States, where we've got people that, well, New York City, people on the southern border, they can go wherever they want without any identification at all. So this is just, this is indicative of what we're seeing. You know, we've got, it's time that we started taking care of our own people.
Thank you, Mr. Denisha. Mr. Smithers?
I certainly would support efforts to try to extend the provision of meals to the elderly. But in regards to using this resolution or expanding it somehow to do that, I think we need to be careful that it seems like this program, which is paid for by the colleges and the state, is for transporting people. And I wouldn't want to endanger this program by violating whatever rules there are. It seems like transporting food is a different category than transporting people.
We're not talking about transporting food. That was just a kind of an aside. Yeah, no, they weren't actually talking. And I probably allowed things to go a little off course, just because sometimes it's good to get these opinions out. But the program itself is strictly about getting the college students around, right?
Correct.
So, anybody else have commentary particularly about that? All in favor? Any opposed? Thank you, Jason, very much.
Thank you.
Next up, we have the Sheriff's Office. Sheriff Engel's here. Good evening, sir. I have a resolution modifying the 2024 budget for the Sheriff's Office for the MAT program prescription costs at the correctional facility, moved by Mr. Perkins, seconded by Mr. Forsythe, Mr. Reagan. Go ahead, sir.
So the first resolution I have here is to amend the budget for the MAP program for the year 2024. We're currently on course to spend about $882,000 this year. And keep in mind, that's just the cost of the medication. That doesn't include people directing programs and the other members that are involved in the MAP program. So we're looking to ask for $300,000. Originally it was $500,000, but a conversation with the county administrator said, let's ask for $3 million. If we got to revisit it, we can. So I hate coming here asking for any money for this, but it's a mandate and I have to.
Mr. Smithers?
Yep. Rick, is this cost borne by the county completely, or is some of this reimbursed by the state because they mandate this?
To my knowledge, right now, this is the cost we have to bear. I am looking into some stuff. It's my understanding that there is could possibly be some grant money out there to help fund this. I've been taking other measures to cut the cost. But it's, medication costs what it costs. I know we spoke earlier, and I stopped down at the community services. Sorry about that. Stopped down at the community services building office today earlier, and I was made aware about the methadone, what it costs per, I believe it's milligram, 3 cents per milligram. They can also get other medication at a reduced rate too. So I know we had discussed in the past about possibly looking at a different provider for the medication to try to save some money. I think I'm going to further our conversation with the Director of Community Services and see if we can't piggyback on them. I know that we've kind of been getting people that are involved with the program. We're trying to get them on the shot. I think it's a better way to go. If the whole purpose of this program is to heal these people, right? I think that we're spending money whether they're in the facility or out of the facility. So if we can get them on something that is long-term, and it seems to be the shot, seems to be the success rate with the Sublocade shot, seems to, along with other parts of the program, seems to be a little more successful. Nothing's 100%. My personal opinion is, having been involved with law enforcement and the drug trafficking and selling in this county for the past 20-some years, probably get shot for saying this, but it's not a successful program. Honestly, I probably shouldn't say this right now, but I'm going to take the opportunity. I think we, the legislators, the board, we need to really sit down and take a look at where we're going with this. I have the opportunity to talk to many people throughout the county. They're not really satisfied. So, sorry to get off track. I'm just here to ask you for money.
Anyone else? Mr. Fay?
Spent a long time talking about feeding the hungry, and now we're gonna say we're gonna give every drug that an inmate wants, basically, by state mandate.
Unfunded state mandate, yes. Mr. Webster?
I guess what really gets me is, not only are we mandated to give them drugs, but we're mandated to give them their drugs of choice. So we could give them a shot once a month, which would be a lot cheaper, but it just isn't like comfortable enough for them every day. That just blows my mind.
Mrs. Haggard?
The way I look at this is, and you said it, Sheriff, it can't be 100%. But what we could do is get a certain percent, I don't even want to guess. And that will eliminate, hopefully, or at least put them on the right path, so that social services doesn't have another family of 5 or 6 kids that have to be taken away. And we all know that this drug thing is propelling what's going on over there and the number of intakes. I mean, it's unbelievable. But if we started out, I know it's frustrating and it's expensive, but the way I look at it is it has a ripple effect, and particularly for children. So thank you.
Anyone else? I'm going to say a little something I normally don't. I understand the state mandate part. Most MAT programs go along with alcohol and drug counseling. I believe, unless I'm mistaken, that that is not something that we have to do for them while they are incarcerated. Is that correct?
The counseling part is part of the program, but it's not mandatory that they participate in it.
So I too understand the harm prevention part of it. I work it every day. I think that they're trying to do something, but I think that I'd like to see it slightly different. We can't do it today, but I mean, that's the part I'd like, is the mandatory treatment. It should be mandatory. Can you put your microphone on? Sorry, sir.
You use the term "they are," they being the state. Okay, the state is great at coming up with these new programs and dipping into the county coffers to fund them. That's where the problem is. And then they take away the bail aspect of putting people in jail, which was one of the greatest things that we had in our quiver to help these people get off the drugs that they're on. The other part of that is that most of them don't want to get off it. They want to get their free drugs in the jail, and they're going to go right back out and do it again. How many times have you got the same people, time after time after time, that you're giving Narcan to? Unreal. It's a problem that's been going on for years, probably the better part of a century. And well, stop and look at it. we've had drugs of abuse since Prohibition,
I was just thinking that.
okay? So, and that's 100 years ago. So, you know, my concern is all this money that we are having to pony up. The other side of that is the mental health issue, where we lock people up in a state facility run by a state organization that supposedly treats these people until they are able to understand charges against them. State runs it, they make the determination when this person is court-ready. And who do you think foots the bill for that? To the tune of 100% now. And you're talking, what, the last figure I heard was $1,600 a day. You got a county like Jefferson that just said, we're not gonna pay this. We're gonna do something, we're not gonna do it. And it might be a time for a revolt, if you will, on the part of the counties collectively to try and put a stop to all this, and, you know, take a look.
Copy. Anyone else?
And I thank the sheriff for bringing this up.
Mr. Forsythe, because Mr. Webster, you've talked.
I can't disagree, and thank you, Madam Chair. I can't disagree with anyone that's made a point on this, but I just don't see how we can't pay them. You know, I don't see how we can say to the state, no, we're not gonna pay you, you know, because they'll just take it out of something else. They'll take it out of sales tax. They'll find a place to put
I
it.
think it would be more to raise the issue, Dave.
The other issue of this, to the benefit, supposed benefit of this, was, are the inmates easier to deal with? That they're all doped up all day, or are they not? Theoretically, that's what was supposed to work, right?
Well, yeah. So, a little while ago, I think I pulled some numbers, and assaults on staff weren't down, assaults on inmates weren't down, contraband wasn't down. So, in theory, no, it's not working.
Okay. So the thing we were sold on doesn't work.
Doesn't work.
Yeah. All right.
I wish I could say differently.
Yeah. So,
Mr.
thank you, New York
Webster.
State.
If this is such a successful program, overdoses aren't down. People dying of overdoses aren't down. And why is public health sending home fentanyl test strips and in Sharpie containers? My understanding is they're not supposed to be doing any other drugs when they're on this drug. We're getting such mixed, how this works and how it's gonna help, it just doesn't even make sense.
So, I'll try to answer your question the best I can, Mr. Webster. So, they're not using the opioid. They just switched to something different, crack, meth, because they still want to get high. They just don't want to be dope sick from the opioid. That's the information I gathered from some of the people that I talked to.
Yes, sir.
But they budgeted money to send home to people on the MAT program, fentanyl strips, test fentanyl strips, and Sharpie containers. What do they need those for if the system is working?
Let's not forget Narcan.
Can you tell me how many of the guards in the prison have Narcan and how many they carry with them? Or do they even carry them with them?
They each carry 2 doses.
They do.
So do your deputies.
Okay.
Thank you. Anybody else? Okay. All in favor? Any opposed? Motion carries. Next up, I have a resolution modifying the 2024 Sheriff's Office budget for the fiscal year 21 Operation Stone Garden Program Grant. Moved by Mr. Smithers, seconded by Mr. Reagan. Forsythe.
So this resolution is just housekeeping. We got to clean up fiscal year 21 Stone Garden grant, and we need to roll it over into this year's budget, and we're in the process of submitting a new grant right as we speak right now. So this is just basically to roll over that money to clean it up and create new balances to move forward.
Anyone have any questions about that? Seeing none, all in favor? Any opposed? Motion carries. Next up, we have a motion, resolution accepting a donation from Purina for the Sheriff's Office for canine dog food by Mr. Smithers, Mr. Forsythe, Mr. Reagan, Mr. Webster. Go right ahead, sir.
Well, I wanted to leave you on a good foot. So instead of spending your money, I'm trying to save you some. We recently found out about a program through Purina that if you have a canine, they will give you a year's supply worth of dog food. We tried to get both of our canines on it. It turns out one of them has severe allergies to beef fat, and all Purina dog food has beef fat in it. So we weren't able to save the money there, but we can save the money with one of them, which offsets the cost of the other one, so it's kind of a wash.
Does anyone have any questions? All in favor? Any opposed? Okay, thank you very much, Sheriff. Thank you. Next up, we have Vacancy Review Committee with Mrs. Doyle.
So following the summary provided to you in the first meeting tonight, there are 3 additional departments to present to you under the operations agenda, the first of which is probation, with 2 tonight. Go ahead.
Good evening, everybody. These two are kind of combined. So the first one, we're asking to abolish our Secretary 1 position and create a keyboard specialist. The reason of doing that is I'm hoping to take our Secretary 1 and make her, what's the next resolution, the next vacancy, I should say, is to make her our an administrative assistant. Doing this move, taking her salary as a Secretary 1 and reducing it down to a starting level keyboard specialist to save the county about $15,000. About $2,000 to $3,000 of that will go to her upgrade to the new position. So abolishing, creating these 2 positions will save the county about $12,000, I'm guessing. So the second resolution is the one I need to talk more about.
Any questions on the first clerical component? Okay, next one.
So the second one, abolishing a fiscal officer and creating an administrative assistant position. My fiscal officer left to go over to the sheriff's. Great hire for them. She's awesome, and I hated to lose her. While she was on maternity leave not too long ago, my Secretary 1 kind of filled in, so she already knows a lot of the job. We do have to show her some stuff and teach her some stuff, but she is on the administrative assistant list. So way back in the day, we had an administrative assistant position. It was Betty Thomas. She retired. And at the time after she retired, the county needed to find a spot for an employee from another department. So they took our administrative assistant position and made it a legal secretary. We lost that position as she left the county, and we had closed out a couple programs that we had, so we lost the Secretary 1 in retirement. So we took that Secretary 1 position, we had 2 of those positions, we took the other one and we made her, we put her in that position. The downfall with the Secretary 1 is she can't supervise the other staff that's out front. With this administrative assistant position, she would be able to do that. She could also do the fiscal officer, the same work, basically. So she's gonna pull over some of her Secretary 1 stuff, she's gonna do the fiscal officer stuff. Now that we've voted on the arming of the staff, she's gonna help out with a lot of that. There's a lot of equipment to keep track of, a lot of training to keep track of. So she's gonna be responsible for all of the training and all of that. She's gonna help write the policies. So we're gonna keep her really busy in the next few years. I'm looking at retiring in about 2027, so I'm hoping in about 2026 to figure out who's gonna be my replacement and start training them. So I'm gonna have that position also take away a lot of the stuff that I do now, the vacancy requests, the travel permit requests, and a lot of the paperwork that I do now. she will also take over that. So it's gonna help a lot with, also with our move, as we have to move out of our space for the new courtroom. There's a lot to do with that, and document management, we gotta figure out what to do with all of our stuff. So this position is gonna be very, very busy. The person that I would be promoting is very capable. She's a 15-plus year employee. She worked for community services for a little while, and did a lot of the stuff she'll be doing as an administrative assistant there. So I'm excited to promote her, and I think she'd do a great job.
Questions? Okay, thank you, Tim.
Great, thank you.
Next up, we have the conflict defender who's joined us remotely. Hi, Amy, go ahead.
Hi, good evening. The position we're seeking to fill is an assistant conflict defender position. It's one of our original county positions. So it's full-time mixed caseload, family court and criminal court. And this is due to a recent resignation.
Questions? And this was also another internal transfer, I believe, correct, Amy?
Yes, yes.
Okay, thank you, Amy.
Thank you.
And the last one for this agenda is County Clerk, who's here to present, following up on the resolution discussion with the motor vehicle clerk request. Go ahead.
So I think pretty much I've made my point about why I need this position. I'll just give you a little background on it. This person left the DMV. She had been looking for another job, actively looking. She wasn't happy there. I brought her over to a vacant position that I had at the county clerk's office because she's an excellent employee and I didn't want to lose her. So that's why I have this position that's vacant. So if I could get that filled immediately, that would help a lot with the processes we're gonna have over the summer.
Questions?
Mr. Smithers?
Do you have any possibility of employing part-time help for the summer?
It takes a very long time to train somebody. It would not be worth it. We do have one part-time person that had retired and came back. I've asked two other people that worked and had retired if they would come back part-time, and they refused.
Mr. Forsythe? Trying.
We're trying.
Thank you, Madam Chair. Thank you, Sandy. A couple things were mentioned earlier. Ruth, you said 3 years ago the revenue was 2.5 or 2.6 million?
Yes, 2.5.
2.5. Last 2 years, 1.9?
After all department costs were paid. Yep.
1.9.
Total, yep.
Okay. And the staffing level stayed the same?
I believe we've added, we added one at least in the last 3 years. One DMV clerk. We can go back and look at that.
Okay. And also, we said 29% at 1/3 is the revenue today, as 1/3 of the year, end of April. Okay. We've also noted that it'll be 6 months before they're ready, which that'll be December, probably January, really, before we hire them.
Right.
So it isn't gonna take care of the summer and alleviate the 3 people,
Right.
but it'll, for the long term.
Right, and they'll
Okay.
be ready hopefully to help with the onslaught
First of
of
25.
the 2025, yeah.
I look at that position, and I remember when I first started here, and Patty started the initiative of Downstate, and the success it had, and the money that it generated. And she would come with a position and be like that. Yep, we'll give you a position, yep, you can justify it, you can justify it, you justify it. Here, we're looking at 600,000 in lost revenue in 3 years. Staffing stayed the same. And we're gonna continue on that path, whereas the sheriff just came to us a little while ago asking for 300,000 for a program that we have no control over. So that's my fiscal dilemma. I texted Glenn here a little while ago. If you lost 700,000 3 years ago, if your revenue was down 700,000, would you have the same staff? No, I wouldn't have the same staff. I'd have to, I'm doing it now. I have to make changes. So those are the things I have to balance out. And then when the 300,000 doesn't sound like it's gonna be enough, he's gonna need 500,000 realistically. Where does it come from? So those,
But you also have to remember, it comes on a cycle, so.
Yep, I get it,
Yep,
I get it,
okay.
I got you.
Yep.
But, all right, thank you.
And to that point, also Sandy referenced the license renewal schedule. If you look in the board share, there's a county clerk folder, SLC County Clerk, the documents in that folder. Any questions?
Seeing none.
Okay, thank you, Sandy.
Thank you. Next up, we have the County Administrator's Report with Ruth Doyle.
Just a couple of items to share with you. Mentioned the license renewal document. Also, we'll add the map and the list that Jason referenced to your board share, as well as send that out to you. This is the time of year, I think I've mentioned it at least once, that the school districts in the county come for a visit. We are more than pleased to share all that we do and all that we offer, and we are happy to scale. The Youth Bureau's been doing a terrific job of scaling everything from kindergarten all the way up to seniors. So please share with the school districts in your districts to give us a call and schedule a time. If they have a field trip option for this year, we'd love to host. Next week, prior to the Finance Committee meeting, we plan to schedule a special board meeting at 5:15. You're familiar, or you'll recall, that every June, Canton hosts the Dairy Princess Parade and festivities over the weekend, and they are used to using the H.B. Smith Building parking lot. And the way that our meeting falls this year will happen the weekend before our board meeting. So we'd like to go ahead and bring that for you for authorization to allow them to use the parking lot, as well as potentially some other business for you to consider. As a reminder, Memorial Day holiday for our county offices, with the exception, of course, of our 24/7, 365 operations. So there's no meeting. That's why we're combined tonight, because there's no meeting on May 27th. And that'll lead us right into the June 3rd board meeting. This Wednesday, May 15th, is the opening annually of our multi-use trail officially. On your desks is a copy of the press release that we're sending out. It has the names and addresses of all of the locations where you can purchase a permit for this year's trail system. There are 9 locations, and we certainly want you to be versed, if you're asked about it, where you can route people so they can purchase their permits. A reminder that the local law is being updated and will be reviewed at a public hearing on June 3rd. And I'll work with the sheriff. We've had some preliminary conversations, but we'll prepare for the patrol of the trails. We anticipate some options around going and scheduling some straight time versus overtime, depending on the manpower that he has at the time. I'll follow up with you and let you know about that. Certainly, the goal of patrols is to ensure our riders are permitted, educated, and that we have a safe environment for all users of the trail. So we'll be talking more about that, but we're very happy that we're now in our 3rd year of the trail, and seeing that all funds raised through the permit sales are reinvested into the trail. They are not put into the county's general fund. And lastly, I wanted to mention tonight, certainly don't require action tonight, but would like to put in front of you a potential change to our schedule. We have grown akin to traveling to the Gouverneur and St. Lawrence County Fair to kick off the annual fair. This year, we would need to move our Finance Committee meeting. We have an open night on the 29th. We'd like to move Finance to that night because that's the night before the fair kicks off, like we have for several years. And that would mean that July 22nd would be an open evening instead of the 29th. So July 1st is our board meeting this year, and as we have 5 Mondays, you have one open. So I'll bring that to you for official action at the board meeting if you're interested. But we would just switch those 2 dates. So the 22nd right now is Finance. We would open that night up for no meeting. And the 29th, we would go to Gouverneur to hold the Finance Committee meeting at the fair. Any questions?
Mr. Forsythe.
Thank you, Madam Chair. Just one question. Do we sell the permits at our DMV sites?
That is a great question. I don't believe so.
Why not?
I'll find out.
All right, seems like a good spot.
Yeah, anything else, madam?
That's all.
So next up, we have committee reports. The Agriculture and Farmland Protection Board, Mr. Tanisha.
Madam Chair, the Ag and Farmland Protection Board, we met 2 months ago, and our next meeting is not until October 3rd.
Copy, thank you. Alternatives to Incarceration, Mr. Burke.
There have been no meetings, so there's nothing to report.
Okay, next up, we have the Board of Trustees for Supreme Court Library, Mrs. Haggard.
We haven't had our meeting yet, but I will tell you, it's coming up. It's usually at the beginning of June, and I will have a report.
Thank you, Mrs. Haggard. Next up, we have the Emergency Medical Services Advisory Board did not meet in April. Next meeting is May 28th at 6 PM. So next month I'll have something. Thank you. On to the Environmental Management Council with Ms. Terminelli.
Thank you. Our last meeting was on April 17th, and Brad Baldwin was our presenter. He has presented to the EMC before. He is a professor at St. Lawrence University, and he works on Black Lake invasives. So he shared with us some information about some grants from the DEC invasives to work on water chestnut pulling, and they'll be doing hand pulling in Black Lake. He said that they are willing to train anybody to encourage people to be part of the solution and kind of that citizen science approach. Indian River is the main source of the new nutrients that are entering Black Lake, that are creating the overgrowth of these invasives. A larger grant could help efforts for larger impact. They would like to ID 3 main spots for the efforts so that they can focus some of the efforts. We also talked about Livingston EMC has reached out to the St. Lawrence County EMC. They would like to connect and just share strategies, ideas, some of the initiatives that they're working on, best practices, marketing, those kinds of items. We talked a little bit about solar, and in that conversation came up some of the national grid, the substations, and the fact that they're at capacity in some areas and would require investment from communities in order to be able to continue to feed power into them. And then we talked about action projects for the upcoming months, one of which to organize and host an IMAPS invasives. I had mentioned at one of the past reports that I did about IMAPS invasives. So they would like to do some of those trainings for folks so that they can deploy the app on their phones and then teach them how to use it. And then researching the creation of a forest health coalition. They also talked about Cornell Cooperative's Extension's new training that they have. It's this Tick Blitz, again, citizen science, that would allow, it trains the public basically on how to sample for ticks and send them out so they can actually look at some of the diseases and some of the different strains that ticks are now carrying. So they have a video training. It was in our Cornell Cooperative Extension email report as well, but video training and collection materials. And so they're looking for new tick species that are out there as well. Our next meeting is May 15th at 6 o'clock at the One Stop Career Center.
Does anyone have any questions for Ms. Terminelli? I have one. As long as we're talking Environmental Management Council, was there any discussion about Deer River and the situation that we're finding going on with that?
So the emails were forwarded on to them, and it will be talked about on this week's agenda on Wednesday evening.
Okay, thank you very much.
You bet.
So then on to the Fire Advisory Board with Mr. Denisha.
Thank you, Madam Chair. Again, I have nothing to report since my last report, but our next meeting is Thursday, June 20th at 6 p.m. But I do want to note that the St. Lawrence County Fire Chiefs Association meeting is this Thursday evening at the Rensselaer Falls Fire Station, 6 p.m.
Thank you. The Inter-County Legislative Committee, we talked some time ago, we don't attend that because it's expensive and the bring back from it is minimal for us, because you go someplace, you have lunch, and you discuss where people go in that county to like sort of look around. So there's meeting minutes, and I will start forwarding them to everybody. And I think next year, we're gonna plan ahead of time, right? And we're going to host the other counties up here to see if we can get like a summertime when we have something going on that would be appropriate to be helpful to others. So that's about it. Questions? On to the jury board, Mr. Sheridan.
The jury board did not meet, Madam Chairman.
Thank you. On to the planning board. Mr. Fay.
On Thursday, May 9th, we met, a number of things sent back for understanding to the towns, their MOUs, basically from the planning office. We had 2 full reviews at the meeting. One was a special permit for a quarry expansion in a rural area in the town of Stockholm. That one ended up with extended period of discussion. You know, how far from the quarry with increased noise should it be from the nearest homes? And start out with some 150 feet with some of the things the town had talked about or had on their books.
It's not far enough.
Talking about, you know, even 100, 250 feet. So a lot of things that we're talking about in there was noise. And the other thing that was talked about is time that the pit could be open. Combination of quarry and rock, stone removal, ground movement, I should say. You know, in some places it's 6 to 6, 6 a.m. to 6 p.m. Suggestions were it should be from 8 o'clock to 5 at night. And really, I guess I could say, we sent back to the town, or going to, like, basically tell us that there was a number of things that we didn't decide on. We pointed out that were probably important for the town to understand, which is a lot of job to do, you know, I believe. And the other one was in the town of Louisville, where they wanted a use variance for a wedding venue and RA zone, and it was lacking a tremendous amount of stuff. We went over, spent a lot of time talking about it, basically sent back to the town of Louisville, who was going to be. Jason was telling us that the discussion was carried out for quite a while, but it really lacked a lot of information we need to simply say we could want them to act on. And I guess that's pretty much the meeting time that we spent on this, which was basically full review. And certainly letting them back, hopefully it'll be back as far as I can see.
Thank you. Any questions for Mr. Fay? Okay, thank you. Any old business? Any new business? Mr. Forsythe?
Annual report from the dock. St. Lawrence River is very low for this time of year. Very, very low. A lot of concerns. Lisbon Beach is concerned, so I don't know what's going on with that. Another thing is I had the chance to attend, John Jeanette had mentioned earlier, or last week, about the Seaway Visitor Center. Went to the grand opening today, very well attended, very, very nice facility, had a nice time. I hadn't been there since I was a kid, I think, so that was nice.
Okay. Anybody else? Okay, seeing none. I would like to mention, Ruth and I had talked about the fact with the delivering meals to the elderly, that we lack volunteer drivers to get out there. And my thought was Factor meals are about $8 to $9 a meal, which was similar to the cost that it takes for us to put them out. They can be delivered by FedEx for a whole week. I know that we do checks on people and talk to them, but maybe we could, if we really just can't get meals out to people, maybe we could have some people delivered one week, the next week they get an in-person thing. But I would wonder if we checked it out, could the county get a different pricing even for some of this than what the consumer gets if we bought a bulk number of things, and could we at least get the meals out to people? It would take care of the cost of having somebody deliver it out there because it's kind of priced into the box. They come, you know, not frozen but cold so they don't spoil. And in the absence of drivers, it would at least get people their meals, and possibly then you can alternate who gets the visit and what week. And it's just something to think about because it fills the spot with nutritious meals. They can kind of pick from a few different diet plans and pick their own meals. In what they do now, I don't know what we could do as a county, but it's along the same pricing as what we're spending now to do it. But it would take away the how do you get them to people? Yes, sir.
Yeah, and I think that's a great idea. You know, it's some brainstorming, because obviously what we have right now, the current model is not working with the resources that we have. And, you know, there are folks, I know a number of folks that you know, if they didn't receive the meals, they would eat cereal. And they'd have cereal in the morning, cereal at noon, cereal at night. So it's, you know, but it's, you know, it's about the meals getting to these folks, but it's also about the wellness check. But I think that's a great idea. Anything that, you know, maybe we're trying to work within the current model, and we should look at another model.
One of the biggest problems we have with the elderly, is lack of muscle mass with mobility. These meals are higher in protein, so it would be able to meet those needs for them. Just a thought. Mr. Reagan, you were next, sorry.
You know, following up on Larry's point, you might want to make a presentation to the Office for the Aging's Advisory Board to get their reaction and get them on board, and then see whether or not the, whatever the state, federal folks that we have to deal with, whether they would okay such a thing, and we can always bring in our state and federal representatives if, you know, the bureaucrats in Albany and Washington are resistant. But, you know, I think that our end goal needs to be to assist these people and help them stay in their home, because, you know, the problem down the road is if they can't get the nutrition they need, they're gonna end up in the hospital, they're gonna end up, you know, it's gonna cost us more in the long run.
Thank you. Mr. Forsythe?
Yeah, thank you, Madam Chair. And there's a wait list yet for people to get delivered meals, right? There's still people on that wait list. So, you know, if we don't have enough money to feed all the people, I'm sure we don't have enough money to transit, so maybe that is a good idea, and option B of something, you know, yeah.
Ruth and I will get to work. Thank you, Ruth. Anyone else have any new business? Seeing none, do we have a need for executive session?
We do, for litigation, negotiations, personnel, which is the medical, financial, or credit or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. And we have one appointment to consider.
Can I have a motion to go into executive session? Mr. Smithers? Cute kidney injury. Yeah, they are. You see on the machine? Well, and that's a bypass thing, they do that, but sometimes the problem is they have to shoot so much dye. We're all set. Mr. Reagan?
Thank you, Madam Chair. I'd like to make a motion to accept a donation of $45,000 from the Warren Buffett Jr. Foundation. Charitable contribution.
And authorize the chair to sign?
And authorize the chair to sign a contract to accept that.
Is there a second? Mr. Fay, Ms. Haggard, Mr. Lightfoot? Any discussion? All in favor? Motion carries. Thank you. Is there any other business before the board? Seeing none, motion to adjourn?
So moved.